Good afternoon. It's Mike Sylvia here with New Bedford Guide and Fall Reporter, and thanks for tuning in, everyone in the South Coast. I'm here with Dr. Adam Saltzman. He's the MD with Southcoast Health. Doctor, if you could just kind of give me an intro about yourself and your role at Southcoast Health.
Sure. So I'm the Director of Structural Heart Disease at Southcoast Health, and that is part of the Cardiovascular Care Center within the healthcare system.
Yeah, and what exactly is the structural heart disease program? And I know it's called the cardiac catheterization lab. Generally entails. Like, what is that?
Catheterization lab. So it's part of that. So it's really a part of a larger program called the Cardiovascular Care Center. The Cardiovascular Care Center is made up of several components. There's cardiologists, there's cardiothoracic surgeons, and then there's vascular surgeons. And then within the cardiology portion of the care center, there are general cardiologists, there are imaging specialists, there are interventional cardiologists, which work in the cardiac cath lab and do stents for people when they come in with heart attacks. There are rhythm specialists called electrophysiologists, and then there's the structural heart program, which falls under my directorship. And the structural heart program really involves catheter-based therapies for things that aren't necessarily rhythm issues or putting in stents in coronary arteries like interventional cardiologists. So we do a lot of catheter-based valve therapies. We do therapies for people with adult congenital heart disease. And then hopefully we'll get a chance to talk a little bit about the Watchman program, which comes under the structural heart disease program at South Coast.
Yeah, I guess the big question out there is, why should someone come see you? Probably we don't want to see you when you have like chest pains and have a heart attack. Probably should kind of see you before then, right?
Yeah. So cardiac disease can present in a very broad and kind of diverse ways. In general, the most common symptoms related to the heart are chest pain, shortness of breath, particularly with exertion or while laying flat, palpitations or lightheadedness, loss of consciousness. And really, if you have any of those symptoms, you really should be seen promptly by a cardiologist or at the hospital. And one of the things we saw with COVID is people were really delaying their presentation, and it was really affecting outcomes. And so if you have any of those symptoms, you really should be evaluated promptly.
Yeah. What are some of the treatments you perform most often?
So under structural heart disease, one of the more common procedures we do is called transcatheter aortic valve replacement, or TAVR, TAVR. It's a catheter-based replacement for the aortic valve. We have 4 valves in our heart, and a valve in a person's heart does the same thing a valve in a car or a plumbing system does. It opens to let fluid go through, in this case blood, and then closes to prevent it from going backwards. And the aortic valve is the last thing in your heart that blood goes through before it goes to the rest of the body. And when that valve becomes narrowed, it carries a very bad prognosis. The only option to treat it 10 to 15 years ago was open heart surgery. And it's a good surgery. The complication rate was low. The success rate was high. It made people live longer and feel better. The problem is people tend to be older when they get this valve problem. And so even though it's a good surgery and it carries a bad prognosis, if you don't fix it, a lot of people weren't going for surgery because an 80-year-old or a 75-year-old going through open heart surgery is not a trivial thing. So now we have a way of doing it with a catheter where we go up through the leg. There are no incisions, and it mimics the good results of surgery. But people stay in the hospital one night and go home the next day, and within a week or two, they're feeling much better.
Yeah, talk about that. That's always interesting to me. People, you think of, I grew up in the 80s and 90s, and they talked about open heart surgery. And then you hear about people who got surgery and they just, like you said, a catheter through your leg. Can you go more into that? It's kind of interesting to me.
Yeah. So back in the 80s or 90s, when open heart surgery was well established, people started using stents or balloons to open up these arteries that were blocked. And the most common reason for going for open heart surgery is bypass surgery, which means you have blockages in the arteries in your heart. That's what causes heart attacks. It can also cause a weakened heart. And now, starting in the 80s and 90s, we started having options with both catheters or surgery, where you go up with a catheter. You would take a picture of the artery with contrast, which is dye. You would identify where the blockage is and then pass a small wire through the artery, past the blockage. and then you'd pass a balloon down and balloon open the blockage, and then put a stent in, which is metal scaffolding that would stay in the artery for the rest of the patient's life and open up the blockage. And so that became a strong alternative back in the 80s or 90s. And then more recently, structural heart disease has kind of taken that same concept and started to treat other things besides blockages in the artery. So we treat valves that have issues, both leaky and tight valves, with catheters. And, you know, it's been tremendously successful and allowed people to recover quicker and have the same good outcomes that the surgeons have been achieving.
Yeah. What does recovery look like compared to what it used to be? This, you know, open heart surgery is cutting your chest open. What does it look like with a catheter?
Yeah. So there are no incisions. It's a needle stick where you put a needle into the artery and then a wire goes through that needle. There are no scars when we're done. The recovery, if things go well, is usually within a week or two. The hospitalization, as I said, is usually one night and home the next day. And people really like having these valve issues fixed. You know, I've had many patients tell me the next morning when I come to see them in the hospital, I already feel a difference. My breathing is noticeably different. And it's one of the more gratifying procedures that I get to do is fixing someone, especially aortic stenosis valve.
Yeah. So the key is we all have control of our own bodies, right? So preventive health is really the way, like, if it's not that I don't like you, but I don't want to see you unless I have to, right? So,
yeah, I understand. I get that a lot.
So eating like a plant-based diet, less red meat, you hear all that when you're growing up, right? So give me some ideas.
And those things are certainly important, and they really help with the most common cause of cardiac disease, which is blockages in the arteries or atherosclerosis. So high cholesterol, smoking, diabetes, poor diet, those things really impact narrowing of the arteries, which again can be treated with bypass surgery or with stenting. It tends to be less effective with valve disease. Valve disease, a really strong indicator for that is just age. And there's not a lot you can do about that risk factor. And so while I completely agree that making sure you have a good diet, making sure your cholesterol panel is well controlled, your blood pressure is well controlled, obviously avoiding tobacco use, those are all very important things for your cardiac health. Unfortunately, when it comes to valvular heart disease, again, the biggest risk factor is aging, and the alternative to aging is worse.
Yeah. And obviously exercise, right? Probably getting out 3 or 4 times a week, even if it's just 20 minutes of walking, right?
Walking is great. And they've actually found that high intensity exercise is also great. And I just think anything you can do to commit yourself to healthy living in terms of exercise is good. In terms of diets, we know that the Mediterranean diet, which is high in olive oils, fish, nuts, fruit, is a very heart-healthy diet and has been proven to be very successful in reducing cardiovascular outcomes.
Yeah, so if patients want to learn more, you can go to southcoast.org/services/cardio-heart.vascular. I'll put that link in the comments. I don't have to go type that out. Any other places you recommend people go check out?
I think we revamped the website a few years back, and there's a lot of informative things there in the different areas that I mentioned. And, you know, in all specialty areas now of medicine, the depth of knowledge, it just goes so deep, and you can really dive into any particular area. The only other program that I would want to mention that I think is important is our Watchman program. So in people with atrial fibrillation, the big concern there is the risk of stroke. The reason that they get that is because a clot forms in the top left chamber of the heart. We usually put people on a blood thinner to reduce that risk of stroke, but taking a blood thinner for years and years and years is very challenging. The Watchman is a catheter-based procedure that puts an umbrella-like structure in the part of the heart where the clot forms so that it can't come out and go up to the brain. We've been doing this Watchman procedure for the last 7 years here. We have a great track record of safety and success. We're actually one of the regional leaders in this area. We're part of a very large, important international randomized trial looking at this device and comparing it to some of the newer blood thinners. It's already been compared and been favorable to some of the older blood thinners. And so this is also an important part of our structural heart program.
Would you say blood pressure is kind of the best way to maybe see if there might be a leading problem, or if I go, because I know like you can go to Walgreens or CVS now, sit at those machines.
Yeah.
If you're seeing like a elevated blood pressure, is that kind of the first sign?
I think it's always important to know what your blood pressure generally is. Keep in mind that blood pressure fluctuates. And so if you get one reading that's high, you shouldn't necessarily be too concerned, but that would certainly be something you want to follow up on. And we know that the higher the blood pressure goes, it's a linear relationship to mortality and cardiovascular health. So, if you're consistently finding that you're having high blood pressures, it's something you'll need to address. And we know from huge trials that it usually takes more than one medication to get your blood pressure under control.
Yeah. So, you get your physical every year. It gives you your blood pressure, but I always recommend you're waiting in line in CVS or Walgreens. They have that little machine there. Get a bunch of tests. After you have a coffee, you might have a little bit higher, but make sure you just constantly do it. Check your blood pressure.
Yeah, I think that's a great suggestion.
All right. I'll let you close with anything else you want to add.
No, I appreciate you having me on and having this opportunity to talk to the community.
All right. I appreciate it. And we'll talk to more doctors in the future from Southcoast Health. Great service that they provide, getting this information out to the community, because really preventive health. And then, of course, talking to the experts is what really matters, not getting all your information from the non-experts on Facebook and Twitter and such. So thank you, doctor, for joining.